Hello, everyone. Welcome to another fire pit chat. Although I have no fire pit, I am on the patio here at Derryfield School. And I welcome you all. I'm delighted to be joined tonight by two wonderful guests. One is Brad Benson, our board chair, and the other is Mike Hirschhorn from Fusion Cell, our consultant. So, little introduction about Brad. He is our first alumni board chair. He's a member of the class of 78, and he's really been an ideal board chair for Derryfield at this moment in history. He is the second longest serving trustee in Derryfield's history, and he's also uniquely qualified for leadership for Derryfield now because he's got a deep knowledge of construction and finance and leading people, which has certainly helped in this amazing couple of years that has seen the opening of multiple facilities. And many people give public service in different ways, and Brad's is to so many different nonprofits, including Derryfield. But he also has tremendous professional responsibilities, including running a 100-year-old plus family lumber business, Benson Lumber. And as I mentioned, serving at a very high level on multiple boards, helping multiple nonprofits. But Brad really finds great meaning in working with Derryfield and interpreting the school's mission for a new generation of students and for countless students in the future, which is what boards really do and look out for. Brad and his wife, Linda, are the proud parents of two Derryfield alums, Andrew and Chris. And we are delighted to have Brad with us tonight. Thanks, Brad.
Thank you.
And then also another person who's given much service, but different kind of service, is Mike Klingshirn, who's our Fusion Cell consultant. And he is an award-winning Air Force public health officer with over 10 years of experience in leading teams, devising strategy, and overseeing operations for compliance programs, as well as for occupational and environmental health and OSHA compliance and health protection policy, and especially relevant tonight, infectious disease control. Mike's last role was with the Air Force for many years, where Mike was tasked with developing a base level disease containment plan. And that plan was eventually adopted as a template across the entire Air Force. He also laid out procedures for pandemic operations across multiple branches of the services, and also worked with FEMA, with state officials, and with National Guard commanders in 12 states. So Mike, thanks so much for being with us as well. Well, the last time we were all together here for this kind of a webinar, we talked about student flow and traffic on campus. And tonight we're actually going to go up multiple levels and take kind of the big view, where we're going to talk about the key principles and the science that's behind the decision making that we've been making since April or May when we began this. We're also going to hear the board's perspective, thanks to Brad, on this new year. Before we begin, though, I want to thank all of you parents for the encouragement that you have sent out to the reopening team. That has meant a ton to those many administrators who've been working so hard since March, and definitely about every day of the summer as well. And also, I want to thank our faculty and our staff, whose unprecedented dedication has made this time feel like a team effort, and something that I will look back with pride on, thinking about the way we did it, not just what we were able to do. So in the United States, opening a school on campus during a pandemic has not been done since 1918. And when I was finishing my PhD, and I was which was in school leadership, and I was in a required course on school facilities management, it did not include a unit on pandemic preparedness. And so when we were faced with this challenge back in the spring, we engaged with a consultancy called Fusion Cell, because we wanted our decisions to be guided by the science of disease mitigation. And so we've been working with Mike and his long-term colleague, Jimmy Adelani, on how to take learning the key elements of health safety in COVID-19 times, and then getting their help to reimagine and adapt just about every aspect of student life, from bus travel to the matriculation assembly, to after school study hall, so that what we're doing is all infused with that knowledge. Our design process hasn't been collaborative, as is usually the Derryfield way. Usually we'd present you all with parents and faculty and staff and kids. We would have a planning draft, we'd get feedback, we'd come back with a new draft, and we'd talk it through. But the pandemic really challenged us with its speed and with the level of seriousness of the health guidelines that we needed to follow, and the myriad of aspects of school life that it impacted. And that really required that the reopening team and the Board of Trustees just had to plan and plan at top speed from April through today. So, and the redesign continues. I was just in a meeting at the end of the day. We will be having these at the end of every day, this being our first day of orientation, and with a meeting of all faculty and staff to review how did the day go for students, what do we need to improve, what aspects could have gone more smoothly, what do we need to know and accomplish this week. And then we had a reopening team meeting right after that to get after those details that were raised in that meeting with our faculty and staff. So that's how we're going to be moving every day until we don't need to anymore, because we're running smoothly. So please recognize that this experience, this design process is dynamic, and that we are certainly nimble and will shift as needed based on the data and the current pandemic situation, so that we will deliver the mission and keep our community healthy. So that may mean that we become more open over time, and it may mean that we become less open, all depending on the conditions that we are challenged by. So first I want to call on our guest, Mike. Mike, would you please share with the viewers kind of the rationale, the high level scientific perspective on why we are able to open on campus with all the students who'd like to, in addition to the students who have chosen to be virtual?
Absolutely. And I hope that my screen is being shared appropriately.
Looks good.
All right, so I am Mike Klingshirn. I'm here to talk a lot about what has happened leading up to today. So some of the policies and procedures, some of the different interventions that the Derryfield School has taken when considering reopening and trying to determine what the appropriate reopening structure looked like. So a little bit about me, like Mary said, I used to be an Air Force public health officer. I've been out for about 3 weeks now, so I separated, and I get to do this as my full-time job with Fusion Cell. My background was pharmacology. I moved into epidemiology and biostatistics at the master's level. I've had a board certification in public health for about 9 years now, and then also added in there a project management certification along the way. So as Mary said, we have dealt military-wise with disease containment planning and planning on how to respond appropriately for whatever comes our way. And that could be anything naturally occurring or man-made, intentional or unintentional. And that's really been the focus of the Air Force and of public health for probably the last decade or so. So when we think about COVID, really what I fall back to is pandemic influenza and really respiratory viruses in general. And what are the safety measures that we need to put in place to make sure that the building is safe before people get there, to make sure that the people coming in are as disease-free and as healthy as possible. So maximizing the health of the folks that are coming in. How are we re-emphasizing those good behaviors with health screenings? And then how do we keep the individual behaviors, so the social distance, the masks and the hand hygiene, at the standards that they need to be at? So things that you may not have seen over the past few months as we have been dealing with the reopening plans really fall back into those categories that I just mentioned. So the first, making sure the air that the students and that the staff will be breathing is safe. So the first thing you'll notice as you walk into these classrooms is that each classroom will have an individual HEPA freestanding air purification unit within it. It's designed to change out the air 5 times per hour. That's in addition to the HVAC system that's already pushing in 100% fresh air while the weather is nice. As The seasons change. The plan is to convert to MERV 13 filtration systems within there. And that will help effectively filter COVID through all recirculated air. Until then, there's going to be no recirculated air. It's going to be 100% fresh air coming into the rooms. For the sanitation piece, Derryfield School has invested heavily in BioAsk botanical disinfectant. And this is one of my favorite disinfectants out there. A different school asked us to find something that was eco-friendly, human-friendly, effective, and fast. And this was the number one choice that came to us as we were looking through thousands of different products that were on the market that were EPA registered as COVID disinfectants. Really, it's safe across the spectrum for human use. It requires very little. The SDSs have it listed as category 4, which means that if there's an exposure to the eyes, it's really just rinse and take out your contacts. So it's very safe for humans, and it's great for disinfecting. It has a EPA listed kill time for COVID of 4 minutes. However, the company has submitted their own lab verified results to the EPA, and that is projected to be cut down to 1 minute here in the next 30 days or so. So the EPA just has to validate the outside labs. For buildings and grounds, the Airx Spray and Go is going to be the choice disinfectant, and that is going to be applicable in all those common spaces. So within the classrooms, the safest possible, eco-friendly, biodegradable, fast kill time will be available. And then for the buildings and grounds, for the general disinfectant, that's where you get into the tougher stuff. So for exclusion, the one thing that we cannot control from the Derryfield side is making sure that the healthiest population comes in. That's really a parent's responsibility to do those daily health screenings. Whether you're on campus or not, the health screenings build that behavior of continuing to do that. And making sure that you validate that your student is healthy when that student comes in. For your student, as they come in, we're gonna ask that they maintain that distance of 6 feet. Derryfield has invested to make sure that each classroom has 6 feet between each person within the classrooms. There's going to be traffic patterns that are going to be marked, and there's defined points of entry so that each class and grade has the ability to move in and out without bumping into other classes and other grades. Mask use will be 100% indoors, but there will be a reprieve. There will be the ability to move outside and utilize that outside air and that outside space. So really using the campus as a classroom to get to those mask breaks. You'll also be taking the mask off for lunch. So there will be predetermined times where that mask will come off in the safest possible manner. Hand hygiene is a critical asset. For here, it's really that personal protective measure to make sure as you're touching stuff, whether it's your own common items or a workspace that somebody else will be touching later on after you disinfect it, that you are cleaning your hands. And that goes into the mask use, because you don't want to use dirty hands to move your mask up and down as you're going to those mask break areas. And you want the cleanest possible hands just because it's a great public health intervention. Soap and water and washing your hands has done more to prolong human life than most other medical interventions. When we talk about COVID, I've noticed through the consulting arena that even as you talk to teachers and sometimes parents and students, that not everybody's on the same page with what the CDC is putting out there. And there's a lot of information. So I just wanted to reemphasize some definitions before we get into it. So close contact is defined as 15 minutes of cumulative time within 6 feet of somebody that was confirmed positive on the 48 hours, so the 2 days prior to symptom onset. So that's a cumulative 15 minutes, and that's what makes you a close contact. The media sometimes uses the next two terms interchangeably, so isolation and quarantine, and there's a big difference between the two. So isolation is something that is used to exclude somebody with symptoms from the general population. So you become sick, you are now isolated. Now, if you test against COVID, and the test becomes negative, you may test out of isolation. It could be the flu or a cold. It could be sinuses. It could be something else. However, quarantine is a different animal. So you have a known exposure. You were within that 15-minute period, within 6 feet of somebody who is COVID positive. So we don't know if disease transmission happens. So we need to wait the full period of quarantine before you can come back into the population. So you cannot test out of quarantine. But the foundational principles that we talked about with the HVAC systems, sanitation, exclusion, distancing, masks, and hand hygiene, those 6 principles, the COVID Big 6, help us reduce risk significantly. And they're each a different layer of risk reduction methods that work together to help ensure that if there is an exposure within the school, that you have the least amount of chance that that exposure will turn into disease transmission. So there will probably be a lot of questions about travel-based self-quarantine. And travel is slightly different because there's an unknown risk of exposure. There's so many different factors of people that interact within your bubble that you just cannot ensure that you have not been exposed. And so that's why when you talk about moving through some of the non-New England states or New England states that have higher risk, that there might be a risk of exposure. So specific to that, airports. Airports have been linked to a few different cases out there, and it's really one of the fastest ways to get a disease to travel. But remember that this is an unknown exposure. So as we talk about places that are safe, places that are not safe, a lot of the information that's out there is going to come back to the numbers and what the news is reporting. So 6 million cases in the US, 189,000 deaths. Those are raw numbers, and they're kind of scary, but they can mislead you. So a good example is 100 cases in California would be a great day in California because they typically average 350 cases a day. Now, if you move to New Hampshire and you have 100 cases in a day, it is a very bad day because that's about 3 times as many as you would expect at the current rates. So when we talk about raw numbers, really what I like to look at is the rates associated with it. So rates being standardized as the number of cases per 100,000 population. And that gives you a good sense of how you rack and stack against different areas. But it doesn't tell the whole picture. So rates plus trends give you that fuller picture. So you can see how you are comparing to other states, but it will also show you whether you're going up or going down. So as we talk about rates, as we talk about the risk, as we talk about the foundation that has been built into the system, there will be some slight modifications. And so as we have moved past the how do we get to school, we have gotten into some of the more challenging questions of how do we offer club sports? How do we offer non-athletic extracurriculars? And so we've assigned risk to it. And risk being, are you close to somebody else? Are you expelling a lot of breath? Are you within that 6-foot bubble of somebody else? So some of the lower risk non-athletic sports that are out there are going to be your percussion and strings for band. So you can offer virtual clubs so that you still have interaction, virtual band practice for those brass and woodwinds, and then virtual choir and non-musical theater being outdoors. So as you move into that moderate risk, that's where people are indoors for non-musical theater, so you have to maintain some extra spacing. You may have some small choir practices, which causes large amounts of air to be expelled as you sing. So that's going to be done outdoors. And then your highest risk is going to be all others. So that'll be doing musical theater outdoors where you have a lot of people singing, doing choir outdoors, in large groups. Doing choir indoors at this time is definitely not recommended. There's just too much risk. Your brass and your woodwind instruments might be done outdoors. So as you think about what this might look like, attendees are going to be challenging to get into that room. You really want to de-densify the room itself. So limited attendance, live streaming productions, using large spaces between people as they're doing some of the moderate or higher risk activities, limiting the amount of indoor high risk or moderate risk, making sure that if you're doing something that's a lower risk or a moderate risk, that if it's non-musical theater, you're limiting those costume changes. You're ensuring that masks are being worn as you're going through those productions. And then we get into sports. And so the big takeaways here, as New Hampshire has given their guidance on what can and cannot be done, is kind of broad, and it leaves some room for interpretation. But really the main takeaways is wear a mask if you're within 6 feet. Don't compete outside of New England. Maintain your distance. Make sure that people's stuff is not co-located so that as you're going to get extra bats or balls, you are not in somebody else's 6-foot bubble. Make sure that you're distanced appropriately while you're not playing. Don't share items as much as possible, or if you do, make sure you can sanitize appropriately between use. There has to be an isolation area for people that become ill. That's both staff and students. You are going to be washing your hands frequently. We once again ask you to not go to sports if you're not feeling well. Things like spitting, chewing gum, sunflower seeds are all out the window. Those are no longer acceptable practices. In sportsmanship, the end of the match shake, high five is no longer a thing. There's going to be alternate forms of sportsmanship that happen at the end. So because New Hampshire's overarching guidance was kind of broad and vague, NHIAA has given some guidance, but it's mostly suggestions. So it leaves decision-making ownership to the individual schools. So who else is Mike Klingshirn? A lot of different things. So I love scuba diving. It's one of my favorite individual and team activities because you don't really have to talk to anybody. I also have played rugby competitively for 16 years. I'm a jiu-jitsu blue belt. I no longer get to practice because of COVID. And I have run 3 marathons. So the New York City Marathon, the Chicago Marathon, and the Berlin Marathon. So 3 of the 6 world majors. I will put a disclaimer in there that I hate running, but I have done it. So when it comes to sports, you have to categorize risk again. And so your lowest risk sports are going to be things that you can do by yourself, without a team, individually, without very much physical contact. So when I think of that, sports that are offered are going to be tennis, outdoors obviously, pickleball outdoors, no contact exercise classes, cross country, individual crew, alpine skiing, Nordic skiing. So things that you can do by yourself with ample space where people are not coming in contact with you. Your moderate risk sports are going to be things that do sometimes have close proximity to other people. It can be incidental physical contact. It could be being close to other people. So this falls into the category of baseball, team crew, track and field, team swimming, field hockey, girls lacrosse, and soccer. High risk is things that require sustained proximity to people, physical contact, being within that breathing zone for extended periods of time. And that's going to be your highest risk for transmission of COVID. Unfortunately for me, rugby and martial arts is on there. Once again, I don't do them anymore, mostly because I'm old and it hurts. But basketball, lacrosse, ice hockey is all on there for Derryfield folks. Why are those rules in place? And why is the competition area that you can go to so significantly small when it used to be very large? And what I really wanted to emphasize is that the disease profile changes, and it changes based on where you live, what's going on, and what the weather's like. So the Northeast has peaked in April and May, and then had a pretty steady state. Now that doesn't mean that COVID has gone away. It just means that large amounts of transmission are being contained, but it is still a slow burning item in the background right now. The South, on the other hand, I live in South Carolina. we have not done well in the past few months, really the summer months. So as it got hot and we all hoped that COVID would not like the sun, it turns out we all went inside into the air conditioning with each other. And so without adequate ventilation, without masking protocols, without increased sanitation, we you can see the data here, we had a spike. We're coming down now. The weather is starting to get nice, but it's still relatively hot here. But my big takeaway from this is learn from us. So the South has given us a good example of what can happen. So if you think about the Northeast and the winter that's coming up, I grew up in Cleveland. I remember what cold feels like, and I remember how often I went inside. And it was the main portion of my day, unless I was standing outside waiting for a bus. So remember that as you go into these public places in the wintertime, assess that risk, make those good choices, avoid crowded areas. And if you know that it's a safe area, if you know that they have increased ventilation or you can visibly see people doing sanitational efforts, it might be a little bit lower of a risk, but more people will always equal more opportunities for disease transmission. So there have been some recent headlines. The first one, a few students were exposed, developed COVID, and then one student brought it into a school after a hockey camp in Conway, and 12 other students were excluded. Another one, a student athlete played a tournament in Connecticut, came back. There were no exposures to the team. Well, there was exposures to the team, but no disease transmission. And the last one was risk mitigation strategies. So those foundations that were reemphasized really played a role, but the sports camp itself was once again that route of transmission for one student. Luckily, in those last two cases, that didn't transpire or transform into disease transmission. But really the big takeaway is it just takes one or two families going outside of the rules, not following the protocols, to start having those problems within a school setting. So please just keep that in mind. So sports offerings. So this is for sports that Derryfield School is going to offer for their students. And the goal of the sports season, as is the goal of the scholastic year, is going to be zero disease transmission while students are playing these sports. So the planning piece that went into it. This is a very slow, very deliberate planning process on how to safely conduct sports, because the responsibility is on Derryfield to provide sports in the safest, reasonable manner for students to play. But with everything in the COVID environment, as long as there is community spread, there will never be a zero risk. There will never be a zero risk activity, whether it's going to school or playing a sport. So we helped work together, we collaborated, and we came up with a progression based on a tiered system on how to get to the ultimate goal of competitions between schools. And so it will take time, but really the emphasis is that you have a tier one, which is always your fallback, your baseline of how sports will be happening. And so that is the individual skills and drills. So I am working by myself, I'm throwing a rugby ball at a wall, or I'm doing long kicks and then chasing it. As you go into the pod system, me and two of my friends are passing the ball back and forth as we run down the pitch. As we go into tier three, me and two of my friends are playing three other folks, and it's going to be a 3-on-3 scrimmage. And as we go to tier four, me and 6 of my friends will be playing 7 other people on the other side for 7 minutes, and we will win. So the decision points. So tier one is your least risk. That's the baseline if disease transmission happens. So how do you get to tier two? It's going to be the quarantine period, so that 14 days, which really translates to 10 scholastic days. So you have tier one, and as you're starting tier one, you start the clock. And if in 10 scholastic days, there has been no school-linked transmission, it means that the foundation has worked and that the school has been proven to be safe and effective. So you move into that next risk category, that next highest risk. And 10 scholastic days is really a 14-day period, which is just exactly a quarantine. So to get to tier 3, you're now in tier 2, you do the same thing. So 10 scholastic days without any school-linked transmission of COVID. And then to get to tier 4, to play another school, they have to have that same high standard of no school-linked transmission within the last 10 scholastic days, so 14 calendar days. And the assumption here is the foundation works. There's strict exclusion protocols. There's daily health screenings before the students come in, and then a relatively informal but thumbs up, thumbs down situation for screening students before they take the field. For the tier 4, competitions can happen, but both schools have to have very strict exclusion protocols, and they have to have the same guidance, because if you're playing with different rules, you're playing different games. So club sports, slightly different. And this is different because parents have chosen an organization and they have accepted that risk. And that risk comes with a few underlying assumptions, which is athletes will be playing from all different communities. There will be athletes from lower rate of transmission communities and communities of higher rates of transmission. So in some cases, your student might be a risk to somebody else, and in other cases, somebody else might be a risk to your student. So that's the underlying assumption. The lessons that we've learned, as we talked about on those 3 headline articles, one student can absolutely have an effect on other students within a school setting. So that means playing a club sport could potentially put somebody else at Derryfield School in a position to go into a remote learning for 14 days. So how do we get to club sports? We have to have excellent communication between parents and the school. And that's going to be through the school nurse, Michelle Leclerc. So as you're thinking about the process, really the key one thing that needs to happen is if your student is told that he is a close contact or you are named as a close contact, that you communicate that to the school and that you set up the ability to move into that concurrent learning environment. Remember that fewer days on a practice field, fewer days in a competition will absolutely decrease your chances of exposure because there's fewer routes of exposure out there. But also, and I just want to reemphasize this, that it is absolutely possible to make it to, say, day 10 of quarantine, and then your student develops a sign and symptom of COVID and tests positive, which would then require isolation and could be another 10 to 12 days. So it could be a prolonged absence from in-person learning. And so that's one of the risks that goes with a club sport. So I always end with my final thoughts. Mike Klingshirn, as an epidemiologist, as a previous active duty Air Force officer, and now moving into the South Carolina Air National Guard as a public health officer. I am always open to new ideas, to new opinions, as long as they're science-based. If you present me with a fact that is counter to what I think, and it's science-based, and it's a better thought, a better fact, a better opinion, I will absolutely take it and steal it from you. I have no problem with that because I'm not bullheaded. My wife might disagree, but I like to think of myself as very open to new ideas. There is a huge spectrum between just that idea of you're either sick or you're well. So if you become sick, there is this new data that's out there of all these younger folks that were sick, but have taken a long time to fully recover. It can take weeks, it can take months. And so as you think about the ability to continue playing a sport, if you can't breathe effectively for 2 or 3 months and it takes you that long to get back to it, it probably wasn't worth it. As you think about the virus itself, this virus does not have a brain. It is not smart. It is not alive. It does not have compassion. It does not have malice. If it infects you, it could, at a minimum, spread to somebody else, and in the worst case, cause death. What we do know is that we have a solid foundation on how to prevent and mitigate the spread of respiratory viruses. And this is not just COVID, this is flu, this is cold, this is everything that we've dealt with throughout human history. So we know the steps to get there. We just need help doing it. The Derryfield School has invested heavily in making sure that the building is as safe as possible, that that distance is maintained, that sanitation is up to par. But then there's also that personal responsibility that goes with it, for the parents to make sure that the students are as healthy as possible as they're going into class, and then on the students to make sure that they're keeping that distance, they're washing their hands, and they're wearing a mask effectively. Everybody has that job, so please help us keep this school safe. And if you need an exception to a rule, there's always an exception to the rule. For instance, mask wear may not be appropriate if there's a physical disability, a mental disability, or a sensory issue. In those cases, we can help get to the right answer that still protects everybody around the individual. And with that, I am done with my presentation, so I will turn it back to Mary.
Thank you, Mike. Appreciate you being here, and we'll get back with the questions at the end. I'll go into the chat and pull some questions out for you when we get to the end. Brad, I want to turn to you, and just with your long association with the school, can you talk a little bit about how you see this period we're in, this pandemic period?
So it's interesting. In my tenure with Derryfield, which has been roughly half my adult life, I've seen many different challenges, but they've always been related to economic cycles. This pandemic, as we all know, is uncharted waters, and it has and will continue to provide a threat to the safety of our community. I think the board's goal is to keep the schools safe and open. All discussions and decisions have been based on doing what is right for the entire community. We firmly believe that we will weather the crisis by being thoughtful, caring, compassionate, and looking out for each other. And I think the difference that I see is that we all have a mission, and that mission is to provide a safe school for the faculty, staff, and the students that go here.
Could you talk for a minute, Brad, about how the Board of Trustees views the reopening of the campus?
So the board is really hopeful that we have no transmissions of the virus on campus. We see our role is to support the faculty and staff in providing the safest, reasonable experience while the students are here on campus. One of the most interesting results I and the board have seen is how the management and opening team of the school, along with guidance from Fusion Cell, is making decisions that the faculty and staff fully support. I also believe that's why parents are choosing to send their children to Derryfield. As probably everyone knows that's on this webinar, we have not seen that from other schools and other school boards. The most important point the board has and will continue to emphasize is about keeping the community safe and not about any one individual or activity. We all need to protect and look out for each other. We're all in this together. And as Mary, as you mentioned earlier, I run a 107-year-old family business. And I know I look young for that, but it doesn't feel young. With multiple locations throughout New Hampshire. We have been open through the entire pandemic, and I have found that we have instituted similar protocols as a school. By protecting my staff through distancing, masks, sanitation, and ensuring that we limit our outside exposure for the good of our community, we have not had any transmissions of the disease to date. I do understand that adults adapting to rules may be somewhat different than 400 tweens and teens. I also understand that it is a fluid process and continues to change daily and weekly. I firmly believe that the established protocols will work and that implementing that at Derryfield, although extremely challenging, is what's right for our community. Faculty and staff will need to be firm on implementing these protocols. I also believe that we do not know what lies ahead and will need to continue to look and monitor at the safety protocols within our community. This is a very fluid situation.
Thanks, Brad. I wonder if you could talk about how the board thinks about the role of the school as opposed to the role of parents. You know, there's definitely a question in the chat about why are certain things allowed outside of school, and it's very much of a a viewpoint of whose realm of influence is where. So if you could talk about that, that would be great.
Sure. So the board realizes that we cannot create a bubble over the campus. We currently serve 51 different communities. We believe that following Fusion Cell's advice can help us minimize the chance of anyone getting COVID-19 from our school programs. I do think that it is important that we all understand that we are all in this together and that we all need to protect each other. In some cases, that will create sacrifice, especially within athletics, visual and performing arts. It absolutely breaks my heart that we believe that that we have to do this, but these decisions and sacrifices are necessary. I also want to remind parents that there are simple things that can be done, like keeping travel within New England states, wearing a mask in public places, keep socialization to small groups, and recommend social distancing. Avoid public transportation and other crowded places. I also think that making choices for your child that are different than what you would have done last fall. For example, in our company, we used to be very strict with attendance and with sick call-outs. Now we have temperature checks and discussions with our employees daily before we allow them back to the work environment if they're not feeling well. We have learned to accept the fact that there is still sickness, but not COVID sickness. And we need to make the right choices to make sure our community stays safe. At Derryfield, we are trusting that parents or guardians are making decisions that will protect the entire community. I think what is also unique about Derryfield is the virtual learning option. As we all know, Derryfield has done this well, and this is a viable option for anyone that is not comfortable being on campus or has had an event, traveled outside New England, family sickness, where they should not be on campus. Mary and I, Mary, as you know, have had many conversations to come back to one simple topic: protecting the safety and well-being of the entire community. Everyone has a role in this.
Thank you. I want to draw out one detail from amidst the instructions that you've described, which is that one thing I've learned from Mike is that parties from the elementary school level to the college level are spreading COVID problematically. Elementary school, Mike has talked about a couple situations with elementary school children. So they're, and small numbers, but it's hard, you all learned how hard it is to do virtual learning, and we've heard about how hard it is to homeschool your children, right, Mike? We've been talking about that for sure. It's also hard to monitor and keep kids 6 feet apart and masked, and taking that on in a home party is definitely an at-risk situation. So I want to discourage that. So let me go now to the chat and we'll see what we have, some questions that we have from our, let's see here. So what if someone develops, this is for Mike, what if someone develops symptoms after the quarantine time of 14 days after the known exposure? Do they then go into isolation, and for how long? I've heard a minimum of 72 hours after symptoms are resolved.
That is a great question. So the CDC has very defined guidance on when you can return from isolation. And that guidance is on the CDC website, and it does change. It changes relatively frequently as things are learned about COVID and how it's presenting in the US. So the current rule is a 10-1 rule. So you stay out 10 days since you had your first signs and symptoms, 1 day of being fever-free. You have to be 10 days past the start of symptoms and be 1 day fever-free without using any antipyretics, your Tylenol, your Motrin. And you have to have symptoms that are significantly improving.
So a question this is really for Brad, I guess. How is it that travel sports are allowed but not local? I would assume meaning Derryfield interscholastic sports. We have no control over who attends the tournament with travel, but that's really getting back to Derryfield versus parent choice. Brad?
Yeah, so I think, as you know, Mary, and Mike was involved in this, there was a lot of discussion at first about no travel sports, then travel sports are allowed, and really based on the protocols that are out there. And in some cases, they're very, very restrictive. For example, Mass has very restrictive rules. That it really does come down to the parents' decision on what to do and what not to do. And about really understanding that it's not about your child, but it's about protecting our community and making that decision and really making that with a level of integrity we probably have never done before, is why we've decided that this is appropriate for the Derryfield community.
Thank you. The next question has to do with, in the last Derryfield memo, I thought the decision was club sports were only permissible if you played travel against teams in New Hampshire, Vermont, and Maine. Outside of that, you could do remote learning. Have we shifted from this? So I'm going to tell you on that one, in part, that question came up really fast before we could even process it through Fusion Cell fully. And so in the short term, we made an immediate, because kids were going out right away and playing travel in the moment and going to tournaments, that we went very conservatively and just said New Hampshire, Maine, and Vermont because of the low incidence of COVID in those states. And then we had the chance to really process it through with Fusion Cell. And so Mike, could you talk a little bit about that? Why is New England permissible now?
Yeah, absolutely. So that is a great question. And I'd like to take a step back from the sports and just reemphasize on the macro level that Derryfield School pulls from 51 different communities. And so with that comes 51 potentially different risk profiles for COVID. And so that is why the foundation, those big 6 principles of COVID risk reduction within the walls of Derryfield, are so critical. And that's why communication is the number one thing that we are asking from parents. There will always be risk. There's risk if you go out to a restaurant. There's risk if you go to a different state to get a different restaurant. So family can also be a risk. It's not just the sports aspect. So as you look at the disease profile for the New England states, you have to realize that, like the chart showed, you did have a spike. There's still a risk, but in a lot of these different states, that risk is very similar. As rates have dropped and decreased, and you get into lower numbers of cases per 100,000 people throughout those different states. And so, is there a significant difference? I would say that there's significant differences whether you go from South Carolina to North Carolina, or if I just go 2 counties over. There's going to be a different risk everywhere. So as you think about the ability to play in those club sports, you have to think about the mitigations that are in place. As Brad was pointing out, Massachusetts has some very strict restrictions on club sports, to include hockey, which is some of the strictest. Somebody was telling me, I don't even know how you're going to play hockey if you can't check or fight. And so as you think about those different restrictions, it's really based on the risk profile of where you're going. And it's based on the risk profile of who you're playing. And it's based on how you can mitigate those efforts, but also on the back end, when you come back into school, how well does that foundation function? And is that student going to be a risk to somebody else? And so, yes, the compromise was maybe we can open it up to more states, but we still need to limit the number of times that people are playing, because we want to limit those potential exposure, potential exposure points. So if you decrease the number of points where somebody is exposed, you inherently decrease their risk. I think that might answer the question.
Thank you. There's a question here about how kids will eat lunch in the classroom without masks. I think that, I mean, just to be clear, kids are not going to be trying to eat lunch with a mask on. So they take their mask off for lunch and they're encouraged to eat it pretty swiftly. This is, you know, a faster experience, and then back on. They're not moving, they're 6 feet apart, and there's no loud talking. Mike, do you have any other thoughts on why lunch indoors unmasked works?
Yeah, absolutely. So once you get to a 6-foot space between students, you have that physical distance. 6 foot is the ideal. I'm putting my arms out. I don't know why you can't see them. So you have 6 feet of distance. Up until that point, you have had a mask on, which decreases the potential bioburden of where you have spread any potential disease. You have clean hands, you have a clean desk, and I think the most critical aspect is the air that's coming into the room. So you're having 100% fresh air that's coming in and changing out that air 4 times an hour at a minimum. In addition, each room has those standalone HEPA filters, which increase the filtration rate another 5 times every hour. So 9 air changes at a minimum for those rooms, which means that you have fresh air or effectively filtered air once every 7 minutes. So you, as you're changing out the air and bringing in the fresh air and filtering out that air, you decrease that risk significantly. So once you have all those the other 5 pieces in there, it is a slightly acceptable risk to take that mask off, eat, as long as you are not talking loudly, you're not expelling breath into a large area. So it's just, you take it off, you eat, catch your breath, recollect yourself, mask back on.
Another question, a series of questions has to do with what about students where their parent travels for work or their parent is an essential worker in healthcare or a teacher? What do we think about, how do you think about that, Mike?
Yeah, wide range of questions there. So the first thing I want to say is if I'm standing and it's Brad, Mary, and myself, and we're all in a room, and I was very far away from Brad, and Mary was very close to Brad, and Brad was COVID positive. If Mary was a contact at that point, and then she came over and talked to me, she cannot pass that contact without having the disease symptoms. So it takes a few days for her to become infective to somebody else. So just because your parent has traveled and had an unknown exposure does not mean that they can bring that infectiveness back until they become infected themselves, if that actually happens. So as you're traveling, remember those COVID big 6. So keep your distance, wear your mask, wash your hands, and make sure that you're paying attention to how things are sanitized around you. And that's going to limit your chances of getting COVID on a grand scale. But you cannot pass an exposure to someone. You can only pass a disease to someone. So in the sense of my parent has traveled and came back, until that person becomes infective or signs and symptoms, there's a very small risk to me as a person. Now, people that are critical infrastructure workers, as you think about hospital workers, other people that are mission critical and have defined exceptions to that rule, really it's about risk mitigation using the COVID Big 6, but there's also additional personal protective gear that those folks are wearing. So as you think about the cloth mask that you're wearing, a healthcare worker is wearing an N95 respirator. As you're walking through the streets and you are wearing sunglasses, if they're close to somebody, they have a face shield. And those 2 things in combination do 2 parts. They stop the source spread. The N95 filters what's being breathed in, and the face shield provides a protection for the mucous membranes that are in the front of the face. So as you layer in those different personal protective equipment, as long as it is effective, it's worn correctly, it's donned correctly, it's doffed correctly, and the sanitation piece is there, that risk is mitigated. And we've seen points of failure in the healthcare system, and we've seen some best practices. And really, I don't think any healthcare worker is going to go out there thinking, today I'm going to fail and I want to get COVID. Everybody seems to be making all of the right choices when it comes to their personal protective gear because nobody wants it. Especially when you think about the outcomes of being sick, being out of work, not being able to provide healthcare to those folks around you. And then also the potential for a long haul disease. It's too much. Nobody really wants to get it. So everybody's hyper vigilant on how they wear their PPE. So really there's a minimal risk. If you're ever concerned, you can always look on the CDC. They have they have different scenarios of how to live in your house if somebody's quarantined, how to live in your house if one of your family members is isolated, different policies and procedures you can follow within your own home to limit some of that contact if it's a big concern of yours.
Mike, could you talk about the in terms of interscholastic sports, why we are taking it so seriously, the tiering? Can you first of all explain the tiering up of how we might sort of earn our way to be able to play other schools that have similar health guidelines to ours. And just as a point of clarification, there's a comment about playing kids from New York. New York's not one of the New England states, so that's not on the table. No one's going to New York. Mike, could you explain that tiered system and how we get there?
Yeah, absolutely. So the tiered system, as a background, has a quarantine period built into it. So you go by your level of risk within those tiers. So your lowest risk participation in the sport is always going to be you're playing by yourself. Your next level of risk would be you're playing with a small team, and you're making sure that there's no disease transmission within your team, but also, and I think this is more important, that there's no disease transmission within the Derryfield school, because it proves at that point that the foundation is solid, even if you're going to challenge it with some exposures. Showing that there's no disease transmission after an exposure is critical. So really what I want to emphasize is that you have to prove that even if there's an exposure or no exposure, there's no school linked, and that's the key, school linked transmission of disease within the Derryfield school population. Now there may be a disease that is passed through a club sport, but that would not be within the walls of Derryfield, and it would not disprove that the foundation is solid. So I want to make that distinction. So really, the fallback is making sure that the foundation is solid. So as you prove that you have the proper foundation within the Derryfield school, you can progress to that next level of risk. Now, if there is a disease transmission that is linked to the Derryfield school, that's when you have to go back to your baseline of everything. So you pull back and you become very conservative in the response. And very conservative in the offerings. And that's usually going to be, with all of the different strategies that were in place, it's going to be a compliance or a fatigue issue. And that's typically an individual behavior. As I think about going back to school, I have seen how close my kid gets to everybody else, and it is not 6 feet. It's probably not 2 feet. She was talking about chasing people and tackling them on the playground today. And that is definitely not 6 feet. She's going to do that. I might as well play rugby. So it's going to be a compliance issue. And as you think through the process, it's really going to be re-emphasizing those individual behaviors, finding where the point of failure was, and then readjusting. And the thing to remember in COVID is that as decisions change, as the outcomes of sports or the offerings for music theater change, it's because the disease profile has changed. We have learned something else, and we've seen best practices. So when we started this whole planning issue way back in March, which feels like 10 years ago, there was no guidance. This was making decisions in a conservative method with no CDC guidance out there. So they brought in the epidemiologists, they brought in myself, they brought in Jimmy. We've worked together forever. We know how each other operates and how we think. And we developed a plan that was darn close to what the CDC put out 2 months later. And so as you think about that, things change and things need to be agile and be able to adapt to what the environment is today. And the past is not a prediction of the future. So spikes can happen. The disease could absolutely just go away magically one day. But I think the spike is probably the more probable of those two scenarios. And so if a spike happens, then the course of action without disease transmission might just be say no sports at all. Too much risk.
So I think it gets back to that sense of the school's purview, sort of a recognition of sort of controlling the controllables, and the things that school can control are the things that happen at school. And then we are going to be trying to, with your help, I hope, impress upon our young people how to behave responsibly outside of school, recognizing that there's a host of things that kids do, from dance to scouting to all different kinds of things that they do outside of school, that they need to follow these protocols with as well. And so our number one challenge, or number two challenges at school, are going to be mask wearing and keeping those masks on and keeping 6 feet apart. And so the more that parents can reiterate that, then the better off school certainly is. And again, this is a relationship of trust where we're trusting that you're going to both help educate and support educate the kids, support the school in those behaviors, and also choose activities for them wisely. And as we go on and new and unexpected turns, hopefully good upward happy turns happen, we'll be consulting with Mike to say, can we change our plan? Can we go a different direction at this point? But it'll all be based on science and data and logic, and that's what we'll be making our decisions around. So it's 7:01, and I've promised to keep these to an hour, so I thank you so much. I thank you all for being viewers tonight. This is being taped, and so you'll be able to see this on the website hopefully soon, and then you'll be able to see all those slides as part of this presentation. And I want to just say special thanks to Brad and to Mike for being with us tonight. Thanks so much.
Thank you.
Great. Good night, everyone. Thank you.